continue to have very positive results here in New South Wales, very positive. And up to 8 p.m. last night, we had one more case confirmed of COVID-19. Particularly pleased to say that it would appear not to be a case of transmission, somebody who's coming from overseas, but Dr. Selvey will address that in a moment. This brings our total cases here in New South Wales to 3,087. In the period up to 8 p.m, we had less tests than I would have liked, but nevertheless we had 6,809 tests. It's almost 7,000, but that compared to the previous 24 hours of 8,995 cases. I would just like to say at this point that it is crucial that people don't relax over the weekends as we go forward in the next months, because the reason we are doing so well in New South Wales is that the community have been partners with the government in making sure that the slightest bit of anything like a cough or a cold or a temperature, people are going and getting tested. And I do fear that people may think that maybe complacency, there may be some level of complacency that sneaks in the next few months as we see these hopefully continuing low numbers. But it is so dangerous. It is so dangerous because this virus is deadly, and we know that. We know that we've had people die from it and people become very ill. So no room for complacency, and continue the partnership, please, to the entire community, all 7.5 million people here in New South Wales. If you've got lightest itchy throat, sore throat, a bit of a temperature, a bit of a cough, a bit of a cold, whatever you think, runny nose, go and get tested. You may be saving yourself, but you may also be saving your family and others in the community. Good news is we've now had 418,427 people tested in New South Wales. So we have had a lot of people who've put their step forward to make sure they get tested. And what I'd like to see is that number growing in the next few months, even though we have very light on cases. We can expect in this particular winter period to see people with cough and flu-like symptoms. And there may be a temptation to think, well, it's just winter. No, it's winter and COVID-19 season. So go and get tested. The other good news is we've had 2,653 people who have recovered from COVID-19 in New South Wales. So we shouldn't forget that you get in, you get tested, and if you've got a problem, we've got a world-class health service and some literally magic health people who are going to work their magic, hopefully on you, if you do get it. So make sure that you get along to get tested. I want to just mention also, which I wouldn't normally do at this stage well, normally we only report up to 8 p.m, but I just want to mention in passing that there was a school or a secondary school student who may have a positive test result that came in after 8 p.m. last night. That student, well, they all went back last Tuesday. That student was at school on that day and minor symptoms appeared the next day, got tested, and we're working through whether or not that ends up being finally a positive result or not. But early indications are anyway that very mild symptoms, and in fact it's believed the student is already well. So I'll ask Dr. Selvey to explain that one as to how he can be that well that quickly, but that's up to the doctors to explain that one. Big day for women in our community, big day for everybody in the community. Beauty salons are open, tanning salons, nail salons, waxing salons. How good is this Sunday? So we will have them open on the 1st of June. I've got to say, of all of the requests I've had as Health Minister in the last 3 months, this has been the one that I think has topped the barrel. It's certainly been a very earnest effort from a lot of people to make sure that we were open. I've even had text messages in the middle of other meetings telling me how bad the acrylic nails are. I didn't even know there were such a thing as acrylic nails, but I now know that. So I'm very pleased that they will now be open. But I'm just saying this to each of the proprietors of those beauty salons, tanning salons, waxing salons and so on, that you must have, before you open on 1 June, you must have a COVID-safe plan. Look at what is actually being advised by New South Wales Health, the public health officials, and make sure you develop your own, because it depends on the size of your premises, for example. if you don't have the requisite 4 square metres for each of your clients, and if you can't maintain the 1.5 metres social distancing, then obviously you shouldn't have as many people in there as you used to have. Your task is to not only deliver the services that people need and want, but also make sure they're kept safe. So just work through getting a COVID-safe plan before the opening on the 1st of June. Finally, I want to say something. This is the last regular weekend press conference that we'll be doing on the COVID-19 for the time being, and if we don't see any upswing, then that's the way it'll be. And I just want to I think it's opportune for me as Health Minister to say, we've had a great partnership between the community and between some gold star health staff across this state. Whether it's the frontline health staff, whether it's the doctors, the nurses, the allied health staff, the physiotherapists, as we heard from yesterday, the cleaners, the security officers, the administrative staff, they have all done a superb job. They've stepped up, and so has the community, to make sure that our community is a world leader in terms of flattening the curve for COVID. So I want to thank every one of our gold star health staff right across this state. I think we all owe them a massive debt of thanks. And finally, I want to remind people that there is an order in place that says that employers must allow an employee to work at the person's place of residence where reasonably practical to do so. As we return with schools, and we'll hear a bit about that in a moment, I just remind employers that they should have a lot of discussing, a lot of yarning with their employees to make sure that what works for them also works for their employees. And of course the value, as we'll hear in a few moments, there are some transport challenges. Not my bailiwick, that's the Minister Constance and Howard Collins. But obviously if employers can facilitate employees to be working from home, that has some obvious benefits for the transport issues. I'm going to ask Dr. Selvey now just to make a couple of comments, and then we'll go to Minister Constance, Howard Collins, and then Mark Scott on education issues, and then Assistant Commissioner Joe Cassius. Christine.
Minister. Very good news. Only one new case overnight, and that was in a person who had returned from the United Kingdom. She was actually screened by the health screening staff at the airport and tested as a result of that. So no risk of transmission within New South Wales. Regarding COVID disease, certainly there is a spectrum of symptoms, and we all know that the disease can be very, very nasty, and some people do die from it. At the other extreme, some people have no symptoms or mild symptoms and can recover very, very quickly. Particularly children, we do know that of all the children that have been tested, the proportion of children who have tested positive is lower than for adults. That children tend to have much milder disease and do recover in general more quickly. But anyone, adults, some adults just also have very mild disease, and they can also recover quickly. I just want to thank the community for their efforts in achieving these very good results for New South Wales, particularly with the social distancing, coming forward for testing, and critically staying home when unwell. And if it wasn't for the community doing this tremendous effort, then we really wouldn't be where we are at the moment. And I just urge everybody to continue, as the restrictions are lifted, to stick within the rules, continue to social distance, come forward for testing, and stay away from other people, even with very, very mild symptoms. Thank you.
Great. Thank you, Minister Hazzard. Look, tomorrow's an important day, obviously, with schools going back, and it's important that we have a number of key messages go out. First and foremost, to parents, please, if you can, drop your kid at school. Alternatively, if kids can walk or ride a push bike, please do so. We are obviously have an enormous challenge in terms of the risk associated with the transport network and the spread and the community transmission of COVID-19. And for this reason, we implemented a transport plan which over the last week has seen a reduction in the number of people using transport. Week on week it has gone down by 3.3%. Particularly pleasing in those numbers is that bus patronage has dropped by 9.9%, so almost 10%. With kids going back, we need parents to be very mindful in and around school zones, obey the law. The 40k school zone is there for the safety of children, but with a lot of parents who are going to be delivering their kids to school by motor vehicle tomorrow, we really urge caution in and around our school zones. In terms of school transport, normally we see about 900 school kids transported across services. Of that, about 110,000 of those kids actually are on the wider transport network. By that I mean they're not in a dedicated school service. What we saw on Friday was around 18.3 thousand kids tap on to the wider network. So with about 110,000 kids who could potentially use the network, it's for this reason that we are urging parents to drop their kids off to school. The other point that I would say, though, is that if you look at the wider road network, last week the network pretty much was around similar numbers, around that 85 million vehicle movements per day. Pre-COVID it was about 105 million vehicle movements per day. So we're still probably 16% under capacity on the road network compared to what we were in terms of the pre-COVID levels. There's a number of other things that we are doing from Transport's perspective to help everybody stay safe. First of all, we're putting in an overflow car park starting tomorrow at Moore Park. There'll be shuttle services between Moore Park and the city. We are going to have dedicated marshals and security teams across the network at 20 key interchange points, including Blacktown, Hurstville, Chatswood and Wynyard as examples where we will have those teams of people. We are encouraging any commuter, including school kids, if your kid's got a runny nose, don't put them anywhere near a transport service or a school. Go and get tested. That's the important message. But please, if you're feeling unwell, don't ride on the transport network. Please stay well away. That said, though, we will continue to clean our transport network extensively. We see trains cleaned at about 4 times a day. We've got roaming teams of cleaners right across the network. Our buses are cleaned twice a day, so we are just working around the clock to keep every vehicle spotless and try and ensure that we don't see any risk to a second wave of COVID infections as a result of the transport network. It is the high risk.